Well, thank you for having me. Again, my name is Piotrowski, and I am a product manager for TRC Healthcare, which I'm sure you are aware is um, it's a product that provides unbiased clinical education and clinical resources and continued education. So I'm sure everyone's stepped into pharmacist letter at one time or another. I'm also a pharmacist. And I have been practicing mainly in the community sector for, gosh, probably about 25 years, holding everything from pharmacist duties to operational leadership, to just recently in the last 3 years, really kind of dipped my toe in the clinical aspect. Oh, there we are. Can you see me now? So I'm really happy to be here. It's exciting to be able to talk about what's coming up on the horizon and kind of where do we go from the last year. So without further ado, let's go ahead and get started. So today we're going to really talk about seizing the day. Basically, it's a new year and what new opportunities are out there given where we've been for 2020. So I don't think anybody can deny that 2020 was in fact a very different year for healthcare. Patient care has become very challenged very quickly. The needs and priorities of our patients changed, along with what some of our business focuses and our priorities were. We really had to find unique ways to really support our patients and our communities, which included everything from how to receive and deliver our prescriptions to providing patient counseling and communicating with masks without fogging up our glasses. So the pharmacy world is definitely a different place now. So our cheese has essentially been moved, as Arthur Spencer Johnson would say. So let's go find that cheese. So there were some positive things that resulted in 2020. Pharmacy received national recognition through the HHS PrEP Act. It really recognized our abilities to be able to test and immunize for COVID and all expanded vaccines. Healthcare providers began to really recognize our skills and expertise that pharmacy brings to the table, especially in this time of need and challenge. So we were really able to use these skills to care for our patients when they needed us most, and were at times their only true point of contact, and live contact at that. So 2020 provided an avenue to showcase our technician skills through testing and immunizations in some states even. But now, how do we continue to build that momentum? By continuing to showcase the skills through professional offerings, and how do we include that and continue to train and upskill ourselves and our teams when traditional training avenues like live conferences and meetings and live classes aren't available? So pharmacists are asking, how do we help make a difference in a time when every hand is needed on deck in order to keep our community healthy? It's not just a put me in coach, but it's, okay, now make me part of that permanent healthcare team roster. So what opportunities exist? You know, we know that there are some older, more traditional solutions. We're already doing them, but we just need to create a renewed process and a renewed awareness. Some can be retooled to be more efficient given the recent technician advancements, like administering immunizations and testing. It's a fantastic way to really show off our staff that you value their skills and that we can provide more services to your patients without negatively impacting an already busy operation. So let's get your technicians involved. So let's revisit first some of those existing opportunities that we already know about. You know, we're more than likely already providing immunizations in your pharmacy, but the recent COVID-19 environment really brought this service to the forefront. It's a great way to really impact vaccination rates by talking to your patients about required vaccines and ensuring that they're protected, especially in this challenging time. You can even expand this into a travel opportunity, you know, for travel health. And of course, that's when folks begin to travel again, by educating them on those needs when traveling abroad. This doesn't have to be expensive. The CDC actually offers training and a ton of resources out there to help identify those opportunities with your patients. And it's a great opportunity for those that work close to those larger global corporations that have a lot of travel involved, so you can partner with them. But then also if you're in one of those larger travel hub cities. So point of care testing. Point of care testing, you think about it, I break point of care testing really into two sections. There's the basic screenings like blood pressure, blood glucose, A1C, cholesterol. There's biometrics like BMI. But then there's also the advanced one. There's flu, strep, COVID, Hep C, HIV. So there's a lot of opportunity and they continue to grow. So there's a room for growth in there. Yeah, you can offer testing to your patient to help them identify those potential issues and also to help them monitor those current diseases that they're already aware of. So it's a great way to really grow into that disease state management program and to help support MTM and grow MTM. Then finally, precision medicine. This is probably the oldest of the three or the newest of the three. And it really sometimes can feel like it's a bit overwhelming, but as we continue to really crack the medication adherence nut, this is really a key to that success. It helps us to really identify what therapy will provide the greatest success with that patient with minimal adverse effects, and it's really the key to their success in therapy. It extends into chronic disease management like diabetes, cardiovascular, pain management, other areas like infectious diseases and oncology. So really it touches every aspect of medication therapy. You also see that we created another area in that precision medicine category, and that's that cultural and environmental counseling. And these are another extremely important area to consider as we're talking about what's going to be the best therapy for that patient. And all of these allow you to really play a significant role into how to help that patient be successful in their therapy. So to be successful, we really have to think out of the box. What services can we provide outside those traditional known clinical services? And how can we operationalize this service in this new normal that we now live in? So for example, how do we provide precision medicine and even obtaining training for that given social distancing? And how do we provide that to our patients given those new challenges of maybe it's through a digital avenue, through telemedicine, telepharmacy, when maybe they don't want to come into the pharmacy because they want to try to limit their exposure. So there's some new other areas of opportunity that I really want you to consider as you think about how you're going to expand your business and expand your practice. And these are just a few. There's many more past this, but these are the few that I thought they were really worth talking about. The first one's that transitions of care. How can we help patients transition out of acute care into their home safely and without that risk of readmission? Patients are being discharged sooner given insurance requirements and stretched healthcare resources amid COVID. So this not only includes that patient, but even those caregivers. How can we support that caregiver, that family member or friend that's going to help that patient once they are discharged from the hospital? More patients are self-monitoring. When you think about all those different devices that are out there, whether it's continuous blood glucose monitoring, cardiac devices, all those wearable devices and apps that are out there in the market now, our patients are really smarter and more exposed to more information than they ever were before with this technology surge. So how can we support them to ensure that they understand all of that information that they're gathering through these devices? And then how do they monitor? How do they use that information to make sure that they stay healthy and that they manage their disease states properly? And how can we support them in that? Cannabis education is another one of those that, we're really charting a pathway in that field. And how can we provide education through our patients and really educate them through drug cannabis information, disease state cannabis interactions, and even safe product use? It's really becoming true now because as we think about the movement of cannabis through the medical card process to that quote recreational area, you're going to have patients that are really doing something similar to how they do now with OTC self-medication. So how can we help that? How can we become educated and really be that point of comfortable contact with that patient to help them navigate through this new area for them? And then specialty pharmacy. Specialty pharmacy has grown by leaps and bounds. I recently read an article through the Drug Channels Institute where they estimate that by 2024, almost 45% of the medications that we dispense in pharmacy are going to be specialty products. So That's huge. Are you ready and are your teams ready to really support that patient and begin that therapy? And that goes everywhere from what supplies are they going to need to administration assistance to adverse effects. Quite often they have specialty support, but you're that person that they've built that relationship with through the rest of their medication needs. So they may still look for you for that support. And are you ready to be able to help them navigate that? And then wellness education, we're seeing more and more preventative medicine, supplements, nutritional support. There's a ton of room for education in that. And how can we help them again with that product selection and being able to really manage that through an education and a consultation point of view? I think of this kind of like MTM plus. We're starting to treat the patient as a holistic patient versus just that prescription med list that we would traditionally look at. So including those OTC items, supplements, natural medicines, all those different pieces. And then finally, MedSync. We've really been talking about this for a while, but larger retailers have really been trying to crack this nut, and it's been moderately successful. How can you, with that relationship that you have with your patients and your customers, really succeed with your patients to help them ensure that they're adherent to their medications and that they stay healthy? So where do I begin? It may seem overwhelming, and where do you begin? And really it's 5 basic buckets that I really think about. First, think about training and certification. National associations and your state associations provide a ton of resources of what you would need in order to start that practice and start that service. They can be a wealth of information, really prevent you from recreating that wheel and move forward in your preparation faster. They often host training and certification programs to help you ensure that you're properly trained, that your team's properly trained, and that you have that knowledge and that comfort to move forward. There's also some private vendors, private education vendors that are out there that can help you navigate those training requirements too. It's been a real challenge because a lot of these were essentially live trainings, which have been halted, at least from those association meetings. So we're really starting to see them reinvent those offerings. Now, how can we provide that, and private vendors as well? How can we provide that through a virtual and still maintain that quality training to make sure that you have that comfort level and that confidence to begin moving forward? Compliance is another big piece of a lot of these. Just again, make sure that you think about those national and state associations and even your local departments of health. They can really help you navigate what applications you may need, if there's any additional certifications or audits or inspections that you will need in order to move forward with these. And that really depends on the particular service that you start. And then program setup. Think about those supplies. Think about what you're going to need. And think about not only those initial supplies, but ongoing. How are you going to keep your supplies up as you grow your business and ensure that you can continue to provide that service without interruption? And then record keeping. How are you going to provide the record keeping? We all know record keeping is, it's become our new normal as well for years. So how are you going to make sure that you have the correct records that you need and that you're keeping them in the appropriate way for the appropriate amount of time and that they're available in case there are any audits or anything that you need to provide? And this is inclusive of not only the record keeping from a compliance perspective, but also think about those records from a patient and for their primary care provider. How are you going to be able to share those records and those results of those services with that healthcare provider to make sure that we have that continuum of care? And then finally, that workflow. We're extremely busy in our pharmacies, so we want to make sure that we have that workflow and that it makes sense. Does it make sense? Is it efficient? Does it provide a positive experience for your patients? So you want to make sure that it really doesn't interrupt those current routines and flows of your team as it reflects on what your current responsibilities and routines are, but then also for your patients as they come into your pharmacy. Does it make sense? Does it flow well for them? Does it really give them that positive experience? And then finally, when we think about marketing and that ongoing education, make sure that you're letting the community know what your offering is going to be. And it's not just when you think about your patients, but think about those healthcare providers, those doctors' offices, those senior centers and senior groups, or depending on what it is, if there's the American Diabetes Association, if there's a local group, for you to really kind of talk about those services and really showcase them and get that word out. Really scream from the rooftops that you now have this service and you're there to help. And then think about, of course, that ongoing education and that team competency. You really have to make sure that you're keeping those skill sets sharp for those new education and process updates. Don't fall behind. Make sure that you're staying the expert and that you're keeping those tools nice and sharp for your new opportunity. So think about, as we round it out, what those keys to success are. Again, know your market. Really know what those needs are going to be in order to allow you to be successful in your new venture. Ask those questions, do the legwork, do the research, listen to your patients. What are they getting and not getting that you would like to have? Talk to those healthcare providers. How can you support them given the times and how they've changed? They're feeling the pressure too. So how can really help them to make sure that the patients stay healthy during this really challenging time? Draw it out. What does it need to look like? What resources do you need? How long is it going to take you to get there? And then really prepare yourself, prepare your teams. Training's key. If you're confident and comforting yourself and your team is comfortable and confident, this translates to the comfort and confidence that your patients will see as they come in for that service and they experience that service that you're offering. And they will, in turn, they'll share that experience with others and they'll really talk you up, and that'll help you build your business. Showcase a network. Make sure that you're telling the world what you're doing. Again, talk about your community, talk about the healthcare providers, talk to them, make visits or calls to those local physicians' offices and senior centers. Make a flyer that you can share, even if it's a digital flyer. Use social media, but really talk about that networking and showcasing your offering. Building those relationships and utilizing those relationships that you already have. And then execute flawlessly. You want to plan. You don't want to plan too long. You really want it to be your passion, because that's what's going to really speak those volumes. If you have that passion in it, you're going to be able to know what you need to know and execute it flawlessly. I firmly believe that you have one chance to really make that first impression with your patient, with your customer, with the community. So make sure you're ready for it and make sure that you make it count. And then again, just don't sit on your success. I can't stress this enough. Just keep exploring, making sure that you look at how can you expand the service. If it's doing really well, what are you hearing back? How can you really expand it and grow it? And then also, are there other services? Now that you're comfortable with that one service, how can you grow it? What else can you add to it that maybe isn't like that current service that you're offering? So just constantly explore, ask questions, and really dig out and figure out what it is that your community needs. So seize the day. You can do it. This is why we chose pharmacy as our profession. Get out there, find your niche, dig in, and just remember that fear is not a factor. So embrace the change and just continue to grow. And thank you.
Okay, well, thanks, Pam. Appreciate that. It's great to see you again. Thank you for coming and joining us again. Sorry for the technical difficulties that got us when we started here. I do have a couple of questions that came in, and I'm going to punt a couple of them down to our panel just because we're running behind as a result of our problems. But the first one, though, is coming from a pharmacy that is just trying to decide what to do with clinical services. And it's such a wide, broad topic, right? So the person's asking, what's the easiest to get into, or what's the least barrier, has the least barrier to entries? Do you think you can answer that?
Yeah, I think I can. It's really look at first at what you're already doing. What are you already trained in? What are you comfortable in? It may be something like, for instance, immunizations. You know that you're already doing immunizations. It's just growing on that. Some of us are already taking blood pressures and we already have patients that are coming in for their diabetes needs. So really finding out what are you already comfortable in? What are you already trained in? What are you already doing as a course of your normal business? That's the easiest, right? Because there's not that learning curve or that setup curve. Some of the other things are bigger, as you think about some of the advanced point of care testing, there's more advanced needs that you need as far as compliance and record keeping. So they're a bigger growth, but I say go with what you already know because they're your quick win.
Okay. Yeah, that sounds good. And I'm sure that our panelists will have, I'll ask that same question to our panelists as well.
Yeah.
There's one more that I wanted to bring up. One of the things that we've talked about previously is drug-induced nutrient depletion. Would you mind just talking a little bit about that? Because that really is a clinical service, is it not?
Yeah, it really is. It's, that's completely part of it. When we think about, I talked about that MTM plus, right? Of how do we look at, the patient as a whole, as a holistic patient, that is where that absolutely falls into play because we have to look at what are they taking as we dig into their disease state treatment and their medication history. How can we help them by supplementing and understanding what those needs are from it may be a non-prescription motive, but maybe we need to provide them with, vitamin C or some other type of nutrient to really reflect that depletion. So absolutely.
Yeah. Okay. Well, Pam, thank you again. Sorry for all the confusion here this morning, but really do appreciate you joining us again. And it's always a pleasure. So I'm going to go ahead and ask you to drop off, and I'm going to ask Brian Hillman to come on to help me present the Climb Ascender Award, and then we'll get to our panel discussion right after that. Thanks again, Pam. Appreciate it. Have a great day.
Thank you.